According to WHO, its China country office was informed of cases of pneumonia detected in Wuhan on December 31, 2019. On 30th of January, WHO declared the coronavirus outbreak as a global emergency. In Malaysia, cases started to drastically increase from 39 infections on 1st of March to 3-digit figures within a week, following the spike in cases linked to the public gathering in Sri Petaling, and as cases rose to more than 200. The government decided to announce tougher measures. The federal government imposed a movement control order to stem the spread of the disease. The order is based on the Prevention and Control of Infectious Diseases Act 1988 and the Police Act 1967. There are 6 instructions contained in MCO, a comprehensive prohibition of mass movements and gatherings, including religious, sports, social and cultural activities. All restrictions on all Malaysians travelling abroad and restrictions on entry of all foreign tourists and visitors into the country. Closing of all kindergartens, government and private schools and other primary, secondary and pre-university institutions. Closing of all public and private institutions of higher learning and skills training institutions nationwide. Closing of all government and private premises except those involved in essential services. From the point of education, home-based learning initiatives was implemented throughout the duration of MCO as schools nationwide were closed during the period. Assessments and examinations were cancelled. Some institutes were converted into temporary surveillance and quarantine centres. Students' performance evaluations were replaced by continuous assessment scores. From the point of economy, closure of businesses and services along with the MCO will have outsized impacts on private consumption and business investment. Individuals and businesses affected by the temporary closures will be at high risk of facing immediate cash flow constraints as their earnings dwindle. Critically, this will impact smaller businesses and vulnerable groups such as lower-income individuals and workers. Factories shut down and massive layoffs. Many people lost their jobs. In response, an economic stimulus package was unveiled. Prihatin's main objective is to protect the welfare of the people, support businesses including small and medium enterprises, and strengthen the economy. From the point of essential supplies, supermarkets across the country began to see a surge in panic buying. The supply of surgical masks and hand sanitizers everywhere was out, causing prices to skyrocket. How exactly does a lockdown work? R below 1. The purpose is to reduce reproduction, in other words, to reduce the number of people each confirmed case infects. Without any lockdown or social distancing measures, we can expect peak mortality in approximately 3 months. The logic is simple. If the MCO is not implemented, COVID-19 will spread uncontrollably as those infected will be transmit the virus through normal social interactions. Starting 23rd of January, the Chinese government locked down Hubei province, including Wuhan, the city where the outbreak started. Following the lockdown, cases began to slow. On 19th of March, China's National Health Commission reported no new confirmed infections in Hubei.
Social distancing is the practice of reducing close contact between yourself and others to help slow the spread of infectious disease and germs. This is because the spread will happen when an infected person coughs, sneezes, or talks, and droplets from their mouth or nose are launched into the air and land in the mouth or nose of people nearby. This infographic shows how this social distancing can reduce the spread of virus. With no change to social behavior, one infected person will on average pass the virus to 2.5 people within 5 days. After 30 days, the figure would rise to a devastating 406 new infections. The number can be significantly reduced by engaging in less social contact, as shown in the calculation. Therefore, social distancing is essential to greatly reduce the burden on health service, and if followed by everybody, this will allow a country to flatten the curve of new infection. So, how to practice social distancing? To practice social distancing, first, we must stay at least 2 meters from other people to avoid being exposed to this virus due to close contact. Social distancing must be strictly practiced when you need to shop for food or medicine at the grocery store or pharmacy. Next, avoid large and small gatherings in private places and public space, because you can be infected by breathing in the virus if you are within close proximity of someone who has COVID-19. Stay at home and stay out of crowded places is one of the ways to practice social distancing. People are encouraged to use meal order for medication if possible. Consider a grocery or food delivery service when there's a need. The company can practice social distancing by launch work from home plan to remain work effectiveness. And the school can also launch digital learning to support student study.
Hi Malaysian!
Here's some tips for you.
To prevent the spread of
COVID-19.
Number 1, avoid touching your eyes, your nose, or your mouth with unwashed hands.
Cover your mouth and nose with your bent elbow or a tissue when you cough or sneeze. Dispose used tissue and wash your hands afterwards.
Wash your hand often with soap and warm water or an alcohol-based hand rub at least 20 seconds.
Avoid crowded places and wear a surgical mask in heavily crowded areas for a better protection.
Follow the directions of Ministry of Health and Majlis Keselamatan Negara.
Stay home if you feel unwell. Seek for medical attention if you are having a fever, a cough, and difficult breathing. Call in advance.
Please make sure to exercise regularly and have a good well sleep.
Avoiding unneeded visit to medical facilities allow healthcare system to operate more effectively, therefore protecting you and others.
keep your distance at least 1 meter to the next person in the public, especially who is coughing or sneezing.
Eat balanced nutrition and please avoid undercooked meats and eggs.
Stay informed, tak pasti, jangan kongsi.
Stay healthy, jangan panik.
Stay at home, jangan keluar.
Stay together by not standing together.
Thank
Thank you to our frontliners, the Malaysian heroes and heroines.
For your dedications and sacrifice
in the fight against
COVID-19.
Together,
Together,
You have to stop COVID-19.